I made a promise to my dad before he passed away that makes me emotional, but I made a promise to my dad if I got a little bit worse health-wise, that I would downshift a little bit and take a pause. I am joined today by my two incredible doctors. They've sort of done an intervention, these two, on me recently, and have been for years, kind of asking me to downshift, and step away a little bit. And so I'm going to step back a little bit from some of the things that I'm doing. One of the easiest things to step away from is this phone right here, and put that down, which means I'm going to step away indefinitely for social media and some other things. A little bit less speaking, strategic in my businesses, and everything will be just great.
So Amy and I have been caring for you for years, and the pace that you are up against, and again, I take care of war fighters, and you're traveling roughly 321 days a year. I will see him, again, we are at mutual events, we have mutual friends. I will see him one day in Las Vegas, then going to Dubai. We're not talking about to Ohio. We're talking about to Dubai the next day, and then back again. It's a lot. You've got multiple businesses, you have a TV show, podcast. I mean, what people see on social media is just the tip of the iceberg. Both Amy and I, as your physicians, have really been at you for well over a year to take a little bit of a pause. So I think it's the best thing for you.
Thank you. Yeah.
Great. We're proud of you.
Yeah.
Thank you, Amy.
Ed, let me also add to this. You've been dealt with some genetics from your parents who are lovely, and they handed you some cards. And you've dealt with those beautifully throughout your lifetime. And we know that stress, which is sort of being in an environment for which you don't have a sense of control over, and with your genetic predisposition to arterial disease, can actually cause oxidative stress and inflammation in the arteries.
This, I think, reaches out to the listeners and the viewers as well, is that also community and being with family is really important.
And this community here is like an extension of my family. So I have the two most brilliant people that I know in my life right here with you today, guys. So we're going to talk about your health a little bit. I'm doing this today so that you don't have that stroke. You don't end up with memory loss. You don't end up with circulatory issues that affect every single part of your body. Let's start out just talking about something that most people don't do, but they should. What's the importance of getting your labs drawn on a regular basis?
Diseases of aging and metabolic diseases like Alzheimer's, like cardiovascular disease, they begin decades earlier. And those are things that people don't recognize. Typically, individuals will wait until, I've never been to a doctor. Now I'm hitting 30, maybe I should go. The best time to start was yesterday, but the second best time to start is today.
There's also genetic testing that can be done too, that can be predictive that somebody's got a predisposition.
It's called the Gallery test, and this is an early detection cancer screening test. There are many different kinds of cancers, and each cancer has its own footprint. And this can test for 68 or 70 different types of cancers at the very early stages.
In the heart world, what are the genetic tests that one can do?
Historically in medicine, all the screens to look for heart disease look at blood flow, where the disease is sneaky. 99% of early plaque grows in the wall of the artery. A workhorse tool we use is ultrasound a lot because it's not just having plaque in the arteries, it's having active disease in the arteries. Because secrets out, you can live a long and healthy life with plaque from head to toe as long as it doesn't misbehave, as long as it stays in the artery wall, because our bodies are built to survive.
Health is the great equalizer, and you can never outrun your health. And that really becomes the common denominator to the impact that anyone listening can do in the world.
Everybody, as a member of my family, please make sure you're taking care of yourself and your health. All the things that we listed here today, I know will make a big difference in your life. So, hey guys, are you frustrated with where you're at right now? Maybe stunted in your progress? Well, if you are, I want to recommend a place for you to go called Growth Day. growthday.com/Ed. It is the #1 personal development app on the planet. It's got all kinds of high performance techniques in there, courses, accountability, journaling, live speeches from some of the top influencers in the world, including me. It's an overall environment to change your life. growthday.com/Ed. Okay, welcome back to the show, everybody. I am joined today by my two incredible doctors. And when I say incredible, I mean they're among the most important people in my life. And so they've both been on the show before. Let me introduce them properly. Dr. Amy Doneen is the medical director at the Prevention Center for Heart and Brain Health. And she's got a book that just came out recently called Healthy Heart, Healthy Brain. She had a previous book called Beat the Heart Attack Gene. And I credit her with me being alive. I think she saved my life. And I've referred her many friends whom I also believe are alive because of her work and care. She's a treasured human being in my life. The other wonderful woman is Dr. Gabrielle Lyon. She's a Washington University fellowship-trained physician. Postdoctoral training was combined with research in clinical medicine, fellowship in nutritional science, obesity medicine, and geriatrics. She's also board certified in family medicine. She just had a book come out that was a New York Times best-selling book called Forever Strong. And she treats some of the most influential people in the world. She also treats warfighters that have been under tremendous stress. So she treats people under great stress. And so we're going to talk about your health today. Before I do that, just a little thing on my health. They've sort of done an intervention, these two, on me recently, and have been for years, kind of asking me to
Yes.
downshift, and step
Yeah.
away a little bit. And so I'm going to step back a little bit from some of the things that I'm doing. One of the easiest things to step away from is this phone right here, and put that down, which means I'm gonna step away
Well,
at least
Ed,
indefinitely for social media and some other things. Go ahead, Gabrielle. You wanted
yeah.
to say something.
So Amy and I have been caring for you for years, and the pace that you are up against, and again, I take care of war fighters, and you're traveling roughly 321 days a year. It's a lot. You've got multiple businesses, you have a TV show, podcast. I mean, what people see on social media is just the tip of the iceberg. You have Arte, you have all of these things, and an individual can't keep up that pace. War fighters go on a deployment and then they come back and then they settle in. And you're not deployment after deployment, there's a pause. And both Amy and I, as your physicians, have really been at you for well over a year to take a little bit of a pause. So I think it's the best
Thank you.
thing for you.
Thank you. Yeah.
Agree. We're proud of you.
Yeah.
Proud
Thank
of
you, Amy. I made a promise to my dad before he passed away that makes me emotional, but I made a promise to my dad if I got a little bit worse health-wise, that I would downshift a little bit and take a pause. And so just do a little bit of that, bag social media for a while, a little bit less speaking, strategic in my businesses, and everything will be just great. So anyway, guys,
We're
excited to
proud of you.
Ed, let
thank
me
you.
also add to this. You've been dealt with some genetics from your parents who are lovely, and they handed you some cards, and you've dealt with those beautifully throughout your lifetime. And we know that stress, which is sort of being in an environment for which you don't have a sense of control over, can actually cause oxidative stress and inflammation in the arteries. And with your genetic predisposition to arterial disease, having this just overhang of stress and workload. And Gabrielle, what did you say? 300, Ed, you told me this too. 300
He travels 321 days a year. Do you know how I know this? Because, well, number one, I'm his doctor. I keep track of him. And number two, I will see him again. We are at mutual events. We have mutual friends. I will see him one day in Las Vegas, then going to Dubai. We're not talking about to Ohio. We're talking about to Dubai the next day and then back again. And this I think reaches out to the listeners and the viewers as well, is that also community and being with family is really important.
for
And
sure.
this community here is like an extension of my family. So I have the two most brilliant people that I know in my life right here with you today, guys. So we're going to talk about your health a little bit and just some things. And by the way, this is every single age, because what Amy referenced about genetics is really important. And so we're going to talk a little bit about that today. Let's start out just talking about something that most people don't do, but they should. So Gabrielle, I'll go to you first. What's the importance of getting your labs drawn on a regular basis? And is there an age of any age that you recommend somebody begins to do that? How often should they do it?
I'll mention for adults. Children are
Yeah.
on a pretty rigorous schedule as to when they're being checked for anemia or lead, even vitamin D nowadays. For an adult, after individuals go to college, it seems as if things fall away. I definitely recommend individuals at 18, if you are listening to this and you are inspired by Ed and you just happen to have a leg up and are involved in the entrepreneurial world, 18, great. We can get a baseline testosterone. We can get just baseline, even as Amy will mention, LP little a, baseline cholesterol screening. And I know it sounds early. However, diseases of aging and metabolic diseases like Alzheimer's, like cardiovascular disease, they begin decades earlier. And those are things that people don't recognize. Typically, individuals will wait until, I've never been to a doctor. Now I'm hitting 30. Maybe I should go. The best time to start was yesterday, but the second best time to start is today and getting not even yearly labs. The younger you are, and if everything is metabolically healthy, um, every 6 months to a year would be okay. But as individuals mature, that window of opportunity to correct things from an underlying perspective that can do damage over time, this could be quarterly labs. It's very challenging for people, but quarterly labs, in my opinion, and I think Amy's opinion, at some point is really ideal.
Yeah.
Yeah.
I got to tell you, and also everybody, this is why I care about you all so much. Just because you feel good doesn't mean it's great under the hood, right? Because this river of life is your blood and you can feel good. In fact, when I met Amy, I don't know, what was Amy, 10, 15 years ago, I didn't really feel that bad, but I had known that there's a genetic history. I didn't have the test yet, but I knew there was a genetic history in my family of different things. My dad's brother died very, very young. And so when I went to see Amy, we were very shocked by what was going on in my blood. And there are markers, everybody, that I think, Amy, most people do a generic lipid panel, but things have advanced significantly that should be tested for now, the last 10 years, even 5 years. What are some things, this is gonna be so good for all of you, everybody. What are some things that like markers people should be getting tested for, Amy? And why, what they indicate and what we're looking for in those markers that probably most people don't get tested for?
Yeah, absolutely. One of the things to remember is that arterial disease, whether it be the small vessels that leads to things like memory loss, vision changes, kidney disease, decreased blood flow to the toes, is the same disease state that also drives your risk of heart attack and stroke. So the little vessels and the big vessels are telling the same story. So part of the most critical thing that is not things that aren't done is looking for inflammation. So if we are able to monitor inflammation, some of the inflammatory labs have what we call biovariability, and those can be thrown off if you hurt your back, if you're, have an infection and so forth. But some are very, very specific for arterial wall health, and they're not skewed by things that life can throw at us. So those are things, if I want to be specific, there's
Yes.
one called LPPLA2 that is indicative of stroke risk. There's one called myeloperoxidase. There's some simple things that are out there for everyone. One is called HSCRP. These labs are easy to get. They're very cost effective. And if there's inflammation, we want to pause and ask why. And when we look, Ed and Gabrielle, at all the root causes of arterial disease, the ones that are just kind of touched on right now that we hear about are blood pressure, cholesterol, and if you smoke, stop. If you're exposed to nicotine, stop. Those are the three that we're evaluated with. Matter of fact, we take our age, our gender, if we smoke or not, or blood pressure and cholesterol, and that's it. But in reality, there's so many others. There's genetically inherited lipids like lipoprotein A. There's a lipid that everyone needs to know about called ApoB, which is like a collection of all the bad guys. We need to know, Gabrielle, you touched on this, metabolic health. So pre-diabetes, which is the fasting growing condition in young adults. It's terrifying. So doing glucose tolerance testing and oral health. Ed, you and I have talked about oral health and sleep and stress management over the years, and those may not seem quite as tangible, but they're equally important as everything else.
Okay, can we go back for a second, Amy, and then I'll throw it back over to Gabrielle. I want you to talk about the LP little a. It's something that you and I have talked about forever. And then why, I know why, and I get tested for it regularly. Wow, I'm behind. I need to get tested again. But why dental health is correlative, why there's a correlation with dental health. So LPA, talk about that a little bit, because I found, I had Bob Harper on my show. I've had other people on the show similar to me that have some form of, heart disease or cardiovascular disease. And it seems as if this LP and people that I referred to, seems that that is a very common marker that's elevated in people that struggle with these things. So why that, this ApoB maybe a little bit too, and then the why dental health matters.
Absolutely. So, lipoprotein A is a genetically inherited lipid abnormality. We either have it or we don't. You can't make it go away. You can't make it part of your system. It's found on chromosome number 6. 23% of adults have it, or people have it in general. Um, the challenge with it is really threefold. One, statins don't necessarily treat it. We've known that. We've measured it for 20 years. It's not a new factor. There are new meds on the horizon, and that's why it's getting a lot of attention right now, which is fantastic. The second thing is that it can really drive plaque development and cholesterol trapping in the artery wall, which is a major problem for early plaque development or atherosclerotic disease development. The third thing it does is make your body really, really good at clotting. So if someone has vascular disease and they inherit a lipoprotein A and they're traveling all over the country in planes, trains, and automobiles, and things you add to that like dehydration, sitting, all the things that can also drive a pro-clotting state, it makes people particularly vulnerable. So one, it can be treated. It just needs to be identified. And three, there are tons of new developments. So people are going to hear a lot about this, and it's a good thing that we're hearing about it, but it's
So
not
good.
new. It's not.
So Gabrielle, there's also genetic testing that can be done too. And so the first of that I heard about was, I think, when it came to women with breast cancer. I remember hearing about that years ago. But now I know, that it's far more expansive than that, that can be predictive that somebody's got a predisposition to whether that be, I think, cancer, heart disease, et cetera. So there are tests, correct, for genetics that one can do now as well. And by the way, some of these things, folks, I think are not, unfortunately, medical care isn't even in our world. And so some of the things we may talk about today aren't part of basic labs, and there may be an added expense. Correct me if I'm wrong about that, you guys, because I want to
Yeah,
be fully transparent with everybody. But the expense, am I wrong? Can you get that done like
there
anybody else?
is.
And two, what tests are there?
There are two main tests that I use in my clinical practice, and we actually use this as well for warfighters through Hunter 7 Foundation. And it's called the Gallery test, and this is an early detection cancer screening test. And it's really interesting because there's only 5 types of cancer that have recommended screening tests: breast, cervical, colon, prostate, lung. But there are many different kinds of cancers. And when you detect a cancer early, there's a 4 times higher survival rate, of course, depending on the cancer. There's 2 main ways in which we can look at early detection cancer. Number one is something called, what was used in research as the Grail test, now available to the public, called the Gallery test. And each cancer has its own footprint. And this can test for multiple different, I think it's 68 or 70 different types of cancers at the very early stages.
Okay.
If you detect a cancer, you can treat it, depending on what it is. The survivability is much higher. The other way in which an individual can be proactive on the offense is something called a Pronovo scan, a full body MRI. It's definitely getting more publicized. I strongly recommend a scan like that because, again, if you catch cancer early, you can do something about it.
Very good. Amy, in the heart world, what are the genetic tests that one can do? I think you're having me, I'll be too personal, but like if you knew your parents had heart disease or cancer, there are tests that you can do now that will show that probably you have a genetic predisposition as well, or did I just completely butcher that?
Can I jump in here really quickly? Because this is important
Sure.
for the listener. Cancer risk increases for everybody as individuals age, but only a small percentage, maybe 5 to 10% of cancers are inherited. The majority are either they don't know or environmental exposures. And I
Okay.
think that that's where lifestyle comes into play. So I don't want people to listen and think, oh, well, this person had cancer in my family, I'm going to get it. That is not
Yeah.
true.
Okay.
There is a way that you can live a lifestyle. For example, we know after heart disease, cancer is the second leading cause of death. And one of the main drivers of that is obesity. So
Hmm.
people can do something about this.
Yeah.
And I want to talk, once we get through these tests, we're going to talk about it. Go ahead, Amy.
Yeah. Well, I was just going to say on the heels of what Gabrielle said, which is so important in that if we inherit a gene, it doesn't mean we're going to get that disease state. It means we want to make sure we're screening, we're taking good care of ourselves to make sure that genetic profile doesn't manifest itself into disease. When you also think about cancer and you think of heart disease, there's so much crossover. As Gabrielle so brilliantly said, there's so many lifestyle factors that drive both cancer and arterial disease. We want to know with your family history, do you have disease? No different than a cancer screen, right? We have these screens for early detection of cancer. We have the same screens for vascular disease. The trick is historically in medicine, all the screens to look for heart disease look at blood flow, where the disease is sneaky. 99% of early plaque grows in the wall of the artery. So if we're on a stress test and you pass that stress test, that doesn't tell you if you have plaque or not. It tells you you don't have a blockage at that moment. So there are some wonderful tests. And as you said, we want to be very transparent with the audience. Insurance does not cover these, but we're talking tests that are a few $100s. Some as low as 50. You can get a CT scan of your heart and look for calcification of arterial disease in the heart. That runs anywhere from $50 to maybe $200. We use a workhorse tool we use is ultrasound a lot because it's not just having plaque in the arteries, Ed and Gabrielle, it's having active disease in the arteries. And that's the trick. If I know you have plaque because let's say you have a calcium score, I really want to know at the end of the day, are you treated and that disease is stable or is it active? So when we use ultrasound, we can depict that. What does the plaque look like in the artery wall? Same with the heart. We can do scans of the heart now and do artificial intelligence overlay on those images and find out what does the plaque look like? Are you and I, Ed, together? Are you and Gabrielle together, the three of us, doing enough to make sure that if you have vascular disease, it is stable? Because secrets out, you can live a long and healthy life with plaque from head to toe as long as it doesn't misbehave, as long as it stays in the artery wall, because our bodies are built to survive. If the plaque's in the artery wall, we are going to maintain blood flow. And things that would cause it to misbehave are the things we've talked about, like inflammation caused by a periapical abscess, an old root canal that's inflamed. To Gabrielle's point, a metabolic dysfunction, whether it be gut health or hormonal balance, insulin resistance, prediabetes, blood pressures over 120 over 75, lipoprotein A, ApoB. Those are all factors that need to be treated because if you have disease, we want to know if you're inflamed. We want to know why you're inflamed. We keep the why, we see the inflammation go down and see the disease stabilize, and you go live your life.
I'm thinking about there's a lot of tests, and I don't obviously want to give too much information, but there was a lot of tests that Amy and I both want you to do that you simply just haven't had time to do. And people have to understand that they really, if you fail to do the practical become impossible. And one test that Amy and I both agree on is something called the sleep apnea test.
Oh, yeah.
Where Amy is talking about labs. She's also talking about, again, because the number one killer is a cardiovascular disease, talking about labs, talking about a scan, CT or clearly scan, very valuable. I mentioned early cancer detection. We cannot forget sleep apnea, and you do not have to be overweight to have sleep apnea. Many of my fittest entrepreneurial patients have sleep apnea. And as Amy will mention, it contributes to metabolic syndrome, contributes to obesity. It affects your ability to put on muscle. It affects, from a muscle protein synthesis response, but, kind of like nerdy. Also, it impacts atrial fibrillation, blood pressure. I mean, it's a big deal. Alzheimer's disease. Yeah.
Really, really good. So one of the things, Amy, when I tell people that we do that ultrasound of my carotid artery and the other things that you and I do, just want to point that out to everybody because they're throwing a lot at you. And by the way, I started to have that done with Amy in my early 30s, you guys, I think. And I have to tell you, maybe it was mid 30s, but I have to tell you, as I tell friends of mine that really have great doctors that we do that, they don't know what I'm talking about. So they have done some of these CT scans, these plaque scans, but most of them have not done that ultrasound. And then one of the reasons that I've learned that it's important is because now you've got something that can be measured over time and see if something's progressing. Where performance is measured, performance can improve or at least be um, altered, at least be mediated, um, maybe reversed in some cases. Amy, the thing I'm doing Friday, is that a unique thing I'm doing Friday? Just share what's that scan that I'm doing Friday. I don't think I've done this particular one before.
You haven't. So the scan you're having Friday is a CT angiography, which is basically an image, takes an image of all the arteries that feed nutrients to your heart. And rather than just look at narrowing or blood flow, we want to look at the wall of all those arteries and find out, what does your plaque look like? Because of your family history, you are predisposed to have active disease. And so what you and I want to determine is the treatment you're on right now effective to stabilize that disease? We have two vantage points. We have the carotids, which we can look at the wall with ultrasound, which is excellent, and no exposure to radiation. So this is one we can use annually, and it is a major workhorse tool. It's been around and back since the year 2000. It's not a
Mm,
new test. Insurance doesn't cover it, so people think it's new. The one you're
mm,
having Friday is to piggyback on that and actually look at your arteries of your heart and determine, is the disease stable or not? And we overlay, as Gabrielle said, a image company. One of them is called Clearly, which looks at the analysis of the plaque composition. And that's what we
mm.
really want to know.
So, hey guys, if you're like me, I am always on the lookout to try to eliminate these cold and flu symptoms. I got to tell you, literally right now, as I'm recording this, the last 3 or 4 days, I was struggling. I've had a cough. I've been congested. I tried an IV. I went and did a bunch of vitamin C. I've tried about everything under the sun. None of it has been working. Bam, someone sends me Armra colostrum, and it has changed everything. Here's the kicker. In clinical trials, bovine colostrum was found to be at least 3 times more effective than the flu vaccine at preventing the flu. So here's our special offer. We worked out a special offer for my audience. Receive 15% off your first order. Go to tryarmra.com/Mylett. That's TRYARMRA.com/Mylett or enter Mylett to get 15% off your first order. That's tryarmra.com, TRYARMA.com/Mylett. These statements and products have not been evaluated by the Food and Drug Administration. These products are not intended to diagnose, treat, cure, or prevent any disease or condition. These statements and information are not a substitute for or alternative to seeking care from your healthcare providers. Okay, very good. So, Gabrielle, what about hormones? So, and hormone health. Let's just talk about that. That's one of your go zones.
Yes.
If you're on hormone replacement therapy of any type, should you be mindful of any markers that can be impacted by that? And B, how important is having your hormones in whatever the normal or regulated range? How important is that?
Hormones. Now, again, this is my perspective. I really feel that hormones are everything. It's the thing that people feel. And actually, this is for both and men and women. Often people will say, oh, testosterone is just for men, but actually, that's not true. Women also make testosterone. It is, when we think about the labs that I'm looking at free testosterone in both men and women. I'm looking at total testosterone. I'm looking at something called sex hormone binding globulin. There are certain things that increase or decrease this. And this is, if you think about hormones like children, they can't go anywhere alone. They need to have someone that holds their hand. And that's what sex hormone binding globulin does. So I look at that. I look at estradiol in both men and women. I look at prolactin, FSH, LH to see how well the modalities that we're utilizing are, and also PSA. This is, I'm sure that I'm missing one or two, but really from a hormonal perspective, these are the things that I'm looking at, and they're both critically important for both men and women. And women, we'll just start there. There's something called female sexual dysfunction, and it's really a common condition for women, and it can affect there's some data that shows 9 to 43% of the female population.
Mm,
Testosterone is not FDA approved for that because it's not approved in women. I eventually believe it will be. But testosterone can be used for women that are struggling with low sexual function.
mhm,
And on the flip side, for men, when a male's testosterone is low, and the way in which we look at it in labs is they'll get 2 morning markers of 300, a testosterone of 300 or less, that would be considered low testosterone. But the reality is that would mean that if someone is 310, does that mean that they're feeling great? No. And this is really the challenge with how we interpret labs. So the signs and symptoms for men of low testosterone would be decreased libido, increase in body fat. Individuals also might have lower bone density or mild anemia. And there was a great trial that has come out recently called the Traverse trial. I just sent it to Amy because it's all about cardiovascular disease and testosterone. There are certain myths that are out there that I think stop people from initiating hormone replacement therapy, but hormones are critical. And then if we take lifestyle into account,
Mhm.
a surefire way to go through and have hormonal imbalance. Ready? So I'm going to give you the ways in which you can do that. Don't sleep, eat poorly, potentially do drugs, a lot of alcohol, and I guarantee you, you will not have a good hormonal status in your body.
Very good. This is so good, you guys. We're gonna go a little longer than I thought, just because this is too good, and I have these two huge brains here. So,
Hey,
Amy,
Ed, can I add to what Gabrielle said? Because from my
please.
perspective, there's a lot of thought that in a cardiovascular world, hormones are bad or they're good. There's this line of division,
Yeah.
and it really is not appropriate because whether we're talking about women or men and hormone replacement, it's all about finding that balance. I'll speak to women because I just spoke
Yes.
about for the Women's Heart Health Month. And what we learned from the Women's Health Initiative, which was a trial years and years ago that really put this negative spin on hormones in women, really has been a real problem for us because that trial took women who had been in menopause, whether it had been surgical or natural menopause, for upwards of 7 to 10 years and gave them hormones that were matched to a 25-year-old healthy female. Well, no surprise that they didn't do well. They had clotting factors, they had strokes, and it became this feeling of hormones are bad, stay out of them in the cardiovascular world. Studies are coming out now that tell us that's not really true. What's appropriate is what Gabrielle is talking about, and that is if we catch people early and we make sure their hormone balance is stabilized to an
Mhm.
endogenous and natural level as early as a woman starts to go through that perimenopausal state. So if she's under 60 and she's starting to have hormonal changes, it's a very appropriate time to make sure her hormones are regulated and for her bone health and even her cardiac health. And even in conditions like lipoprotein A. So it's all about finding that balance. And for men, although I do not manage hormones, it's not my expertise. I rely on people like Dr. Lyon to do that. The reality is, if a male has a low testosterone under around 350, the metabolic outcome of that is not favorable. Whether we're talking about diabetes, whether we're talking about obesity, whether we're talking about poor sleep, etc. So I
Mhm.
agree 100% with what you said from a cardiac standpoint. It's all about finding that beautiful balance. Hormones are not all good or all bad. It's about having them managed very, very well.
Cool. You
That's
gave a good level
absolutely
number there.
correct.
You gave a good level
Yeah.
number. One thing I want to say to everybody too about testing, it just occurred to me. One, like, if you have that, maybe your children should get the genetic test. The other thing is there's tests now that you can see, like we discovered, I don't get personal and medical stuff, but I potentially have a predisposition to clotting. And then there's also how you can get tested to see how certain medications will affect you. And it turned out, like in my case, think about this, everybody. I have a predisposition to clotting, and the main drug they give you when you go to the hospital for clotting, I'm not going to name it, would very much adversely affect me.
Yeah.
And so this is how sophisticated medicine has gotten now. Would you not like to know that if you went into an emergency room, they're about to prescribe you a drug for something you have, and it's a drug that will not work on you and could potentially harm or kill you.
Yeah.
And so that's how sophisticated this stuff gets. As terms of women, Amy, really quickly, I want you to talk about two things. One, what you and I have a mutual person that we both love that we recently found out. She's probably got some difficult labs as well. And when you would look at this person, you would just literally never imagine that this person could have any form of potential disease going on inside of them. So, a lot of my audience, more than half, are women. And I think oftentimes when people think heart attacks or heart issues or strokes or Alzheimer's, all these sort of correlated issues, vascular issues, I think you usually think of a man. But
Yeah.
the data tells us what about women and how important it is that the women understand the data as it relates to them as well. Obviously, men, we kind of know, but what about with women? This is important, everybody. You young
Yeah.
women, listen close.
Yeah, so the statistics are staggering. So 1 out of 3 women will die from heart disease unless we do something different. Currently,
Wow.
1 out of 31 women die of breast cancer. So the statistics for heart disease, and the other thing that's happening, and I'll just say this one more stat, the awareness that heart disease is our #1 cause of death is actually going down. Comparatively to 2009 to 2019, breast cancer awareness went up, which is a good thing, but it doesn't mean that heart disease awareness needs to go down. So both should be celebrated that we are at risk. And the idea of having an optimistic bias because we take care of ourselves, perhaps, we look okay on the surface. Heart disease doesn't care. It doesn't care. The guilt associated with heart disease needs to be just gone. It needs to be gone. And what we need to do is really look for disease early, and that can be done very cost effectively. I talk about that a lot in both of my books, but healthy heart, healthy brain really brings it down to a level of, as Gabrielle said, start when you're 18, find out what you're dealing with so you can make decisions of screening as you go through your life. Take
Yes.
control over that. Secondly, for women, we as women can have the exact same risk profile as men. It's not like, oh, the men in my family had heart disease. Well, maybe the women in your family manifested that differently with memory loss or vision changes or kidney disease or peripheral vascular disease, and the quality of life wasn't there. It's the same disease state. So
Wow.
women are often missed, and I'm very passionate about that because a woman looks okay on the surface, or quite frankly, struggles with some lifestyle factors that may appear that, oh, she definitely might have risk because of X, Y, and Z. That's not true either.
Yes.
Heart disease doesn't do that. And there's clues. One more thing, sorry not to talk too much, but I get really passionate about
I
this.
love it. I love it.
Clues as we go through our life, especially with pregnancy, with women who do have the opportunity to go through a pregnancy, we can learn a lot. If a woman is dealing with hypertension during pregnancy, a 64% increased risk of heart disease throughout their lifetime. Is if a woman has preeclampsia during pregnancy, a twofold increased risk of heart disease and clotting risk throughout their lifetime that manifests within the first 10 years, even of that child being born. So the child is still in grade school. Gestational diabetes is another one. It's not a matter of if that woman is going to deal with prediabetes, type 2 diabetes throughout her lifetime. It's really when. But it
Mm.
doesn't mean that it has to happen. If women are educated and their care team takes a hold and responsibility of that, we move forward. Part of the challenge, I think, and Gabrielle, you and I've talked about this. Who claims responsibility of something that if we do our job right, no one's going to feel the benefit? Do you see what I mean by that?
Yeah.
So, like,
Yeah.
and if you and I do our job well with your family history of vascular disease and your potential risk for vascular disease, and we do our job well, which means we monitor you, we follow the data, we look at the science, we treat everything that you've been dealt with, lifestyle, including stress, and as Gabrielle so appropriately said, sleep quality and efficacy, and we treat that. The benefit of what you and I are doing means you go live your life and
Yeah.
you don't have a heart attack, you don't have a stroke, you don't have memory loss, you don't have vision changes, you don't have that. And in my biased opinion, that's not the role of traditional cardiology. They do amazing work once there's a blockage. In
Yes.
Gabrielle's work in functional medicine and um, hormones and internal medicine, her goal is that you maintain your health, not rescue you when it's fallen. And that
Right.
takes initiative both of the patient and of the healthcare team.
So good.
Yeah.
Gabrielle, I want to ask you something about that. And by the way, everyone, I'm doing this today so that you don't have that stroke. You don't end up with memory loss. You don't end up with circulatory issues that affect every single part of your body. Gabrielle, Amy brought this up, and I don't know why I think about it more when it becomes to my female friends than my male friends, because everybody deals with stress. But oftentimes, I feel like some of the women in my life are responsible for so many different things at one time. But this is true for anybody. What about overwhelm and stress management and how important that is? Just any tactics or strategies or your thoughts about that? Obviously, we spend time talking about that, the three of us with me, um, which is one of the reasons I'm going to downshift a little bit. But what about overwhelm and stress management? How critical that is? Because you could be doing probably everything right from a nutritional standpoint, and even with the different supplements or medications that you take, the scans. But if you're living in massive overwhelm or stress, that's a trigger, I think, even to turn certain genes on potentially, I think. So what are your thoughts about that?
Well, it's interesting because we have one word to describe all these different things. Stress it describes that the dog, went to the bathroom on the white rug, or you had to go to the DMV and you forgot your paperwork. And or we use the word stress to define heart attack, the death of a loved one. It is the only word in the English language that has this massive undefined umbrella. And by thinking about it that way, we have to understand that our body's internal reaction to the stimulus is quite incredible. And when I say that, I mean things like increasing levels of workload, increasing just the burden of things over time. And what happens is, again, when we talk about stress, we're talking about high responsibility type things, is that the body, and we see this all the time with elite warfighters, is the body goes into somewhat of a sympathetic overdrive. And what does
Yes.
that look like? And it doesn't turn off. There's a normal sympathetic and parasympathetic response that it's almost as if an individual gets a trauma, and I use that word loosely, and the body continues in overdrive. Blood
Mhm.
pressure goes up, heart rate goes up, inflammatory markers go up, increasing in cortisol. Cortisol goes up. And, Amy was talking about gestational diabetes and these, um, and somewhat of these metabolic influences. It destroys skeletal muscle.
Mm.
And that is your metabolic sink. And what happens over time is you stop sleeping, your brain responds. When I was at WashU in geriatrics, one of the things that I was responsible for as a fellow is that you run a cognitive memory and aging clinic. And one of the questions that we always would ask would be stress, because we know that there's an impact on the quality of the brain if an individual is experiencing exceedingly high amounts of what they perceive as stress. Stress you
Mhm.
have to mitigate. I'll tell you this, you cannot get somebody better if you do not manage that. You just can't.
Mhm.
And I'm sure Amy agrees. I can provide hormone replacement. I can prescribe a nutrition plan. I can prescribe a diet. That's, say, the ideal diet. Individuals who are feeling and experiencing this um, sympathetic overdrive, their inflammatory markers will go up. For example, autoimmunity. Autoimmune conditions are nearly impossible to treat if you cannot address stress. And the list
Mm.
goes on. So I won't take GI problems. If you don't
Mm.
address that, you will see the gut will be in overdrive. People will be nauseous. They will have diarrhea. They won't be able to absorb nutrients or put on weight. It is a highly complex interdynamic. Humans exist in this homeostatic way of being a web of everything. You
So
have to
good.
address.
Yeah.
It's so good. All right,
One of the
couple more
things
things. Go
I've
ahead,
said
Amy.
on that, Ed, I'll just say this really. I didn't create this phrase, but I think it's so powerful. And that is, the brain is our most powerful pharmacy. So as Gabrielle said, we can really think about our best lifestyle and nurture ourselves. But if our brain is really perceiving a lack of control over our environment, even from my standpoint, from arterial disease, it changes something called smooth muscle cells in the artery wall that become maladaptive and actually trap cholesterol, because the brain is really, it's so powerful, and that's a wonderful thing. And that's why when you asked Gabrielle and I to come on this podcast, Ed, and you were so honest and vulnerable to your audience and say, look, I'm important. You are important. And to make sure that you're present for your audience, you need to make sure your health is top notch. And what you're doing, I don't know if you know the magnitude, but you're giving every one of your listeners permission to say, pause for just a moment, everybody, and look at where your priorities are. Are you seeing your family as much as you want to? Are you getting your health checkups as much as you want to? Are you sleeping as well as you know you should? Just pause for a self-assessment. And if some things are out of sync, out of balance, take the time to fix them and get support and get help, because we can't help anyone else unless we make sure our own world, in a sense, is healthy.
And
Thank you for
Amy,
saying that. Thank you for saying that. And I'm gonna let you both make a couple final comments here. Gabrielle, you'll go first. And by the way, everybody, I just want to say this. I wanted this to happen today because I love you and I want to make sure you're caring for yourselves. And most of you, I feel like sometimes are pouring from an empty cup. You're pouring into everybody else all the time. And, one of the things I love about faith is that you can be poured into and fed. And I wanted that to have that happen for all of you. I also have concern that in this society, including me, we're pushing separation season. We're pushing this, the other thing. I'm right now, my separation season is going to be for my health. And for many of you, it's the thing you're going to get around to. And I've just had too many friends. I'm turning 53 here. I've had too many friends that aren't here anymore that we're going to get around to it. And I don't want that to be you. I certainly don't want that to be me. And so anything, lastly, Gabrielle, I know you wanted to say something there, and then Amy, I have one final question too. But anything you want to add, a marker, a thought, as we kind of put a bow on things today, Gabrielle, and thank you. By the way, you're all welcome. Just shared these two brilliant people with you for the last 40 or 45 minutes. So first off, thank both of you. And then what would you want to add there, Gabrielle?
health is the great equalizer, and you can never outrun your health. And that really becomes the common denominator to the impact that anyone listening can do in the world. You must address this. And quite frankly, Ed, Amy and I have really been encouraging you to take a pause for a long time, for longer than people know, just to be able to do all of the things that must get done. And so thank you. I think Amy and I are both very excited about that. And then the next thing is that what you do today matters. People struggle with discipline and how do I really need to go to the doctor? Do I really need to get this blood work done? Yes, you do, because if you fail to see the long-term trajectory and you put it off, a lot of entrepreneurs put things off, the outcomes are not good. And much of what we are talking about, from cardiovascular disease screening to cancer screening to muscle as this organ of longevity. We didn't really touch on training, but that really is amazing. And understanding your hormonal status. These are all things that can be tackled first and foremost, even from a knowledge base and then a lifestyle perspective. 70% of Americans are either overweight or obese.
Yep.
All
And
of
by the
that.
way, everybody, one thing on training, let me interrupt you. You can go back and listen to the episode with Gabrielle on that, and also my episode with Amy as well. We go a little bit deeper dive on some of these things. Didn't mean to interrupt you. Go ahead and
Yeah.
do that. Yeah.
So these lifestyle factors, it truly is the only thing that you have control over. You don't have control over your genetics. You can control what you do, how you live your life, how you manage stress, how you interpret stress, and also execution on getting the blood work done and then following up and making those needed changes, which is grossly overlooked.
So good. So good. Amy, two things. I'll let you give some final thoughts, but you got to tell them about the crinkled ear.
Oh,
And also, we didn't touch on HRV, and I don't think most people even know what it is, but if you would just touch on those two things and then final thoughts. I don't want to get out of here without those two things, and then whatever your final thoughts are.
yeah. So the fun thing you brought up is called Frank's sign, and there are these what we call red flags. These we don't really know why are associated with heart disease, but they are. And one is this interesting little diagonal crease in the earlobe that once I share this with people, it's like a party trick. You can't help but like start looking at people's earlobes. But if someone has a diagonal crease, it could be one or both. It could be male or female. It gets more pronounced as we get older based on collagen in our skin and so forth. But If you have a diagonal crease, it's called Frank's sign. Dr. Frank discovered it. You have a 78% increased lifetime risk of having multi-vessel coronary disease. And it's one of the red flags that, okay, so go get plastic surgery and fix it. Doesn't mean your risk goes away. No, it just means if you have that, it's not your fault. Like, find out if you have heart disease.
Not my fault. I have it because I have it, as you know. So it's not my fault. It's just
Not your fault. Not your fault.
someone gave it to me. All right, go ahead.
And then you had mentioned heart rate variability. That's one of the little tools. We've got Aura rings. We have all these fancy watches. We have all these great biofeedback tools, which I'm a fan of, the CGM monitors, all of that. But if heart rate variability is high, we need to understand, like, high or low, basically, like what our heart rate variability is. And as we move forward, if that heart rate variability isn't managed, as Gabrielle said, get a sleep study. I think every human, every adult at the age of 50 or higher probably should get a home sleep study. So just tools like heart rate variability and resting heart rate should be low. When we sleep, our heart rate should really fall. In the morning, our blood pressure should be at its peak best, meaning lowest, under 120 over 75. And if it's not, just ask why, ask why.
Okay.
So,
All right.
I will
Yep,
say
you
in
guys
closing,
are- yeah.
I will say
Yeah,
in
go ahead.
closing, Ed, you fly 320, 40 days a year, right? And what do you always hear? You say, if some tragedy happens, put the oxygen mask on yourself and then go help everybody else. What you're doing right now is just acknowledging to your amazing audience and giving permission to say, you're going to pause and just do a self-assessment and say, gosh, how long has it been since I've done X, Y, and Z? Amy wants me to get my labs. Gabrielle wants me to get my labs. Amy wants me to do these tests. I'm just going to pause and step back a minute, and I'm going to do a self-checkup on my health. Everyone needs to do that, because in one thing I've learned after 22 years of doing this in heart disease prevention, when I meet people after they've had a heart attack, after they've had a bypass, after they had a stroke, they all wish they would have. There's not one person that would say, I am so glad I didn't pause and get checked out. I'm so glad I didn't do that. Like, that's never the common thread. So we want to maintain our health. And in order to do that, we need to pause and do a self-assessment. And these tools are out there and they're available.
What a
I'm-
beautiful conversation today, and I'm grateful to both of you and everybody. I'll be on this pause for a little bit and see me speak a little less. I'm not going to be on social and some other things. I mean, more strategic in where I spend my time. Business is obviously going to continue, coaching, all that other stuff. So anyway, today was so special to me. I have to tell you that you're the two most amazing people, and I'm so grateful that you're in my life. And I'm so grateful I got to share both of you with the world again today. And just today, everybody, as a member of my family, please make sure you're taking care of yourself and your health. You can read the books of these two women, and it'll help you do that. And all the things that we listed here today, I know will make a big difference in your life. So Amy, thank you. Gabrielle, thank you. And God bless you, everybody. Max out your life.